let's talk about stem cells, because I know a lot of patients, we get the PRP questions
Yep.
and the gel they talk about, but they
Mhm.
mention stem cells.
The inflammation was triggered by some sort of movement dysfunction.
Yeah,
And if we don't identify that movement dysfunction, the definition of insanity is doing the same thing over and over again, expecting a different result. I do what's best for my patients at the end of the day, and that's my obligation to my patients. And our mission is to get you back to doing what you love. So.
hey guys, my name is Ken Clark, owner of Purpose Physical Therapy and host of the St. Pete Professional Spotlight Series. Today I'm excited to feature Dr. Ron Torrance. Dr. Torrance is a non-surgical orthopedic physician and a nationally recognized leader in interventional sports medicine. Based at Regenexx here in St. Pete, Dr. Torrance specializes in orthobiologic procedures using highly precise image-guided injections, helping active adults and athletes stay active without surgery. With board certifications in sports medicine and osteopathic treatment, Dr. Torrance blends advanced clinical skill with a whole body movement first philosophy and approach. He serves as president of the Hillsborough Osteopathic Medical Society, a board of trustee member for the Florida Osteopathic Medical Association, chair of the Health and Wellness Committee for the American College of Osteopathic Family Physicians. An author, speaker, and thought leader, Dr. Torrance has contributed to peer-reviewed research, co-authored Exercise 2.0 for Regenexx, and has presented at conferences across the country. In 2016, he was even invited to serve on the medical team for the CrossFit regionals and games. Outside of medicine, he lives what he teaches, staying active as a semi-professional beach volleyball player and a competitive CrossFit athlete. He's also a devoted husband and a father of two. So welcome, Dr. Torrance. Thank you so much for joining. I'm so glad to speak with you.
Well, I'm grateful to be here, Ken,
Yeah,
and super grateful to work with and collaborate with patients with you and your team.
yeah,
And we were just
yeah,
talking about one here before we got started, and
yeah,
super grateful that she's doing well. Happenstance is that she had a follow up today, and she's
yeah,
about 70% better, and her foot issue's getting a lot better. So
yeah,
super grateful
yeah.
to you. Thank you so much.
Awesome. Absolutely. Yeah. So like I said, I'm sure we'll get more into that and kind of what you do and who you help.
Mhm.
I would love to kind of start by just the listeners and myself kind of getting to know your story a little bit and
Mhm.
your background. Obviously, you're an athlete and you've competed in CrossFit and beach volleyball. How has that shaped your approach into your patient care? And how has that impacted your journey on the way in your specialty?
So sports have been in my blood since I was
Mhm.
as old as I can remember.
Yeah.
And I went to college and played baseball. And after
Cool.
college, I was looking for an outlet. And
Hmm.
that outlet became beach volleyball. I
Yeah.
grown up in Sarasota, Florida, and came home from college and was trying to find my path and getting
Hmm.
into med school. And I ran into a friend of mine from high school, and she was a professional beach volleyball player. And I
Hmm.
was like, man, this is pretty cool. And she's like, come out, you're tall, you can be a block for me or something, right?
Yeah.
So I got hooked and still play to this day, pretty high level. And
Awesome.
that's where everything kind of came from. I mean, I
Hmm.
also then started getting in CrossFit because I went up and did my internship and residency in the Philadelphia area. And in Philly, you can't play beach volleyball year round.
Right.
So, so CrossFit was a really good outlet. Anytime I could go play, I'd play. But
Hmm.
even in South Jersey, it was kind of fun. We'd go play at our friend's house. But
Yeah.
the CrossFit keeps you strong so that you can continue to play at a high level. And
Yep.
so that was really how CrossFit and beach volleyball kind of come together for me.
CrossFit is definitely perfect for that too. So,
Yeah. Mhm.
what's inspired you to pursue sports medicine or your specialty in
Mhm.
general, which is more of that regenerative type of non-surgical approach?
So, as most things in life, I
Hmm.
was pursuing orthopedic surgery. That's what I
Hmm.
thought I wanted to do. And through adversity and overcoming not being one of the 30% picked for the orthopedic surgery residencies,
Hmm.
I found a niche field and really have dove into the field of interventional orthopedics, which is my analog to that is interventional cardiology, right? So you used to have to open the chest to do a stint or to do
Right.
kind of
Right.
thing for the heart. Now you can go in through the wrist even and put in a stent in the heart, right? That's interventional
Wow.
cardiology. And
Sure.
interventional orthopedics is catching up in that realm where we inject precisely with image guidance. And the precision is
Mm-hmm.
one of the biggest factors that makes us different than Joe Schmo down the street who does what we do.
Mm-hmm.
We're putting it right in the right place to institute change
Mm-hmm.
and create new inflammation to help the body heal itself.
Mm-hmm.
This is what we specialize in, non-surgical. And our mission is to get you back to doing what you love through non-surgical orthopedics.
Mm-hmm.
And so that's really where I've focused my and honed my practice for the last 10 years almost. And really, we track all of our outcomes, which makes me super, super excited because our
Yeah.
patients are part of the largest registry in the world for non-surgical orthopedics. And we can say that based on our registry data, about 89 to 90% of our patients, if they're a candidate,
Mm-hmm.
get better through our procedures. Now, 90% success rate, that's pretty good. So,
Yeah, that's amazing. Actually, is there any particular story that comes to mind of a patient's transformation that kind of really reminded you of why this work matters and why you do what you do?
we're about to put out essentially, we like to do patient success stories and, you can do
Mm-hmm.
case studies on these things too. One of the ones that comes to mind recently is he's got a bad elbow
Mm-hmm.
arthritis. Replacing the elbow is a little difficult. You got a lot of
Yeah.
ligaments, a lot of tendons. And so he being only able to golf, he's in his golden years, as they call them,
Mm-hmm.
right? And
Yeah.
he's only able to golf like once every fourth day. And if he golfs the next day, his elbow's super sore, swollen, he can't do anything.
Mm-hmm.
And so we did bone marrow concentrate, where your stem cells come from, into his elbow. And he recently went to New Zealand and Australia, and I believe he golfed like 17 days straight with very little pain in his elbow.
Yeah. That's
So
amazing.
it
Yeah.
was his bucket list trip, and that's somebody to me. It's like fantastic, and he's willing to sing praises to the rooftops
Mhm.
for us because he knows that his elbow replacement didn't have to happen to
Yeah.
this point, and it made a big difference in his life and enjoying his life. So
Yeah. Yeah. That's awesome. Yeah.
yeah.
And I'm always interested in this, and I know a lot of probably the general public is too when they're looking at a provider to somebody to help them. But it's to kind of just getting to know them as a person a little bit too. So my question is there any personal values that you've kind of carried with you growing up that you take along with you in your approach to helping patients? And um, second question, in addition to that, is what do you define as exceptional non-surgical care, especially at working with active adults?
So attitude determines aptitude is something that I've always thought about in my life, and having a positive
Hmm.
attitude and positive perspective and positive outlook
Hmm.
can really, really help with anything in life, right?
Yep.
And I told you about the adversity I already faced and how I pivoted and found something that, listen, isn't necessarily exactly what I wanted, but it's the niche that was right for me. And I
Sure.
saw that we needed to fill a need and fill a space. And so that positive attitude helped me find a place where I can help more patients and help them get better.
Hmm. Yeah.
And with your follow-up question, then becoming, what's the difference? And what's the difference between all Florida Orthopedics, Florida Orthopedic Institute,
Yeah.
Alexander Orthopedics? That's utilizing the ultrasound and or fluoroscopic guidance. And those
Mhm.
are all in my office. We're not sending you to a surgical center. We're not sending you to some off-site clinic that they're going to bill your insurance $1 million and you're going to see all these different bills flying around. It's all in our office. It's not where sick people live in the hospital or anything along those
Mhm.
lines. And
Yeah.
we're doing this at the peak, and we're the tip of the spear in this circle because of the outcomes data and the tracking of the data that we have.
Mhm.
And we have the world's only corporate program. So
Mhm.
we have self-funded insured groups that cover our procedures.
Mhm.
There's no other group in the world that has that. And so
Cool.
7-Eleven, the Diocese of St. Pete, Manatee County Schools, Morgan Auto, I believe Crown Auto is about to come on board. I think of July 1st, I actually went and got my car serviced, spoke to
Yeah.
the woman there. She was fantastic. She said she great work. And she had these plaques saying she'd been there for 30, 35 years. I said, you
Wow.
don't happen to know the CFO at Crown? And she goes, yeah, I can get you his email. I was like, well, listen, we have this corporate program. And she introduced me to one of her associates who was like, I've got back issues. Can you see me? I go, let me see what I can do. So
Yeah.
our corporate team is fantastic. We have 2,500 self-funded companies that cover our procedures. So yeah, we're
Mhm.
doing this at the pinnacle and the peak of what there is out there. And
Mhm.
that's really what I think makes us difference. Makes
Yeah.
us huge different, you know.
Yeah. So when you mention the 2,500 private corporations,
Mhm.
how does how can somebody know that may watch this that's kind of interested? It's like, hey,
Mhm.
how do I know if I work for somebody that would cover your services? What does that look like?
So typically they'll get a mailer from their benefits provider
Yeah.
saying that Regenexx is a covered benefit. Okay.
Okay.
That would come in a mail either on a card or something along those lines.
Hmm.
Sometimes those self-funded groups won't allow us to do that. We try to do that so that they know that we're a benefit.
Yeah.
So and so understand that you're self-funded. A lot of places are self-funded, and it's a whole unique conversation that I don't think we have time for today. But
Yeah.
understand that talk to your employer and
Hmm.
see if what their benefit options are. Do they have any additional kind of cool benefits that might be outside the box? And we're one
Yeah.
of those.
Yeah.
So,
Cool. Yeah. And before, even getting into all of that, I think it would be important to kind of dig a little bit more into kind of what you do
mhm.
specifically. If we can just kind of like maybe clear that up, like what
Okay.
if somebody's listening, watching, what would make a good candidate for uh, being a patient at Regenexx and
Yeah.
receiving your treatment, your procedures?
So some of the most accepted procedures that we do, and TRICARE actually covers PRP, platelet-rich plasma, for knee
Hmm.
arthritis.
Okay.
Okay. And so TRICARE is a large insurance group, mostly for veterans, and I appreciate
Mhm.
our freedom. And so something for any veteran out there. And so they also cover for elbow, lateral epicondylitis or tennis elbow, right?
Yeah.
And those are some of the most well-studied platelet-based procedures that we do. And we do that with ultrasound guidance, and we do that now. I finding that why am I saying about the TRICARE coverage? I know that it does cover it. I don't think in the East it does, but in some locations in the country. But just want to
Mhm.
kind of bring that. So those are the most accepted ones.
Sure.
Now I'll tell you that some of my favorite ones that work really well is looking at the lumbar spine, patients with disc issues, any kind
Hmm.
of herniated discs, bulging discs, annular tears in their discs.
Yeah.
A lot of times those lumbar lower back patients, they do fantastic. And we see a lot of those for not only
Hmm.
lumbar, but cervical
Hmm.
spine. And we do fluoroscopic or X-ray guided injections. And typically they're with platelets, to be honest with you, for the lumbar and cervical spine and the thoracic spine. But
Hmm.
those do fantastic. We've been able to see those discs actually shrink on
Hmm.
follow-up imaging. And those are some of the most gratifying. I have a Coast Guard CrossFit friend of mine. This is somebody I can talk to you about. Um,
Yeah.
for lumbar spine. He came in, and I just got his follow-up MRI because he wanted to check it out. He's like, "I'm 90% better, Dr. Torrance." That's something that I think that's is great to show and see, and I think that it proves that what we're doing isn't just hocus pocus. It's
Yeah.
science, and it's based in literature that it actually works. So.
Yeah, absolutely. And is that something? So obviously, back pain, sciatica type stuff, disc injuries. Um, I'm thinking of people that maybe uh, have tried physical therapy or something like that in the past, or
Mhm.
and it's kind of just been lingering. It comes and goes, and they don't want surgery. Uh, that would be kind of a perfect sort of next option, or even a first option if they don't know about
Mhm.
it.
Mhm.
Totally makes sense. So if are you guys always kind of doing like a pre-test type of MRI, ultrasound, and then are you frequently doing kind of a post-test like MRI just to like you did like you showed me to see, hey, how is this responding and what
Mhm.
does this look like, and what is the outcome with that? Is it to make significant changes on a radiograph, or is it um, ultimately to get them to feel better, obviously? But what is kind of your guys' view on that when you're working with somebody?
So symptoms subjective are
Mm-hmm.
the number one thing we're going to be looking at, right? So somebody
Yeah.
comes in, they've got a 7 out of 10 back pain with radicular symptoms down to the left leg, right?
Mm-hmm.
There's a lot of things to digest there, right? The
Mm-hmm.
radicular pain, do they have actually axial back pain as well? Do they have walking intolerance, right? So that
Mm-hmm.
sit down frequently. That'd be more usually with stenosis, central stenosis,
Mm-hmm.
right? So
Yep.
looking at a lot of those things, right? So I always try to ask a patient, if I get rid of one thing, right?
Mm-hmm.
What's the one thing symptomatically that really is really causing the most issues for you, right? I mean,
Mm-hmm.
there's and so usually that's what I hope, like I'm gonna write down all these. It's gonna be an hour-long eval, which I think is different than anything else. We do an hour-long evaluation of our
Mm-hmm.
patients, which really is much different than the typical orthopedic model.
Yeah, that's true.
And and so we spend time with our patients diving into that history and physical. And I think I've heard this in a lot of circles. A good history and physical, there's no substitute, right?
Mm-hmm.
The patient will tell you what's wrong with them.
Exactly. I
And
agree.
so diving into that, right? And so subjectively changing things is probably the number one thing that we're shooting for, right? Making the person get better subjectively on a pain scale, the visual acuity, visual analog scale, and go, hey, listen, you're from a 7 to a 2. Is that success, right? So,
Yeah.
I think a lot of times they go from a 7 to 2, they're happy with that, right? And
Mm-hmm.
especially if
Mm-hmm.
it's the degenerative nature, right? So if it's a degenerative back versus more of just a herniated disc, those are different cases in my book, right?
Yeah. Yeah.
The herniated disc with radicular symptoms and the 30-year-old or the annular tear with the sitting intolerance
Mm-hmm.
is going to be a lot different, and I think they have a better long-term trajectory. Um, in this fact that we can actually get that to objectively heal, right? So I can see the annular tear get better on the,
Yeah. Yeah.
I can see the disc shrink. Now, the degenerative spine, we might not be able to see that some of the things get better, the facet arthritis. We might not be able to
Right.
get some of those other things that are going on in the back to objectively get better. But just like anything else, right? Degenerative spine issues are more of, I mean, we do steroid injections all the time for knees with degenerative changes. I would
Mm-hmm.
tell you that seeing us for platelet-rich plasma or bone marrow concentrate is going to be a longer, better course and going to protect your knees cartilage and protect the bone and make the bone stronger. But the same thing here for back issues. We may not be able to objectively see it with some imaging,
Sure.
but subjectively, if the person's 60, 70% better,
Mm-hmm.
um, we might not need to get them on a maintenance program where we do maybe a procedure once every 2 years or so, just to make sure that we keep that. Inflammation is really the basis of pain, in my opinion, and I think that it's the opinions of most people. But how do we get that inflammation out of the areas that are causing the pain? So
Mm-hmm. Mm-hmm.
um, I guess to answer your question, subjective and objective, I think subjective is the first thing, just kind of rounding this out. Subjectively, I want the patient to feel better. I'll order additional imaging if somebody's like, hey, listen, I really want to see it. It's going to mean a lot mentally to me if I can see that my objective findings have gotten better.
Yeah.
That was really one of the reasons why I got it for this gentleman. He's like, hey, listen, I want to see that, like what's happened. And
Mm-hmm.
fortunately enough, it objectively was getting better. And I told
Mm-hmm.
him, hey,
Yeah.
listen, can we get it a little bit better? And is there room for improvement? Do you feel like you're 100%? He's like, no, I don't feel like 100%. I'm like 90%, I was like,
Mm-hmm.
listen, if we do this again, there's a good chance that we can get that to shrink even more, right?
Yep.
And so
Yeah.
add positive response. It's going to make your back more bulletproof, as I like to tell patients. And we can get
Yeah.
those multifidi muscles stronger because when we inject the multifidi, if there's any multifidi atrophy, we're going to help with that. We're going to help
Yeah.
with the interspinous ligaments. We're going to help with the capsules on the facets. And so really it's a we call it a functional spinal unit approach to get the back
Mm-hmm.
pain.
That's cool.
Yeah.
That's awesome.
Yeah.
Yeah. Same thing with as in physical therapy. Obviously, ultimately, the end goal is you want to get the patient saying they feel much better. That's the most important, I think. And just like what you mentioned, the objective is sort of kind of filling in the gaps in between. We got to measure to some degree like where
Mhm.
we're going. What are some things that we can actually measure or see that may or may not be contributing to how you're feeling?
Mhm.
Not necessarily like shooting in the dark or shooting in a barrel, but at the same time, We want to have those measurements to be able to see what we are improving on. But ultimately, like you said, yeah, the subjective is obviously we want people to walk out of there saying, I feel so much better, even if minimal changes happen.
And that's why I love the model of physical therapy that
Mm-hmm.
purpose physical therapy brings, is that
Yeah.
it's hands-on,
Yeah.
one-on-one work
Yep.
where you're working with a well-trained doctor of physical therapy
Mm-hmm.
who's going to not only give you some exercises, corrective exercise for afterwards, but they're going to
Yeah.
do some hands-on work that's going to actually change the tissue.
Yeah.
And
Yeah.
in my perspective, the tissue usually is the issue.
Mm-hmm.
I like to use rhymes. I don't judge. But if somebody's
Love it.
not touching your tissues or not putting their hands on you, there's a lot of new age stuff where
Yeah.
we
Yeah. For
I'm
sure.
not a super big subscriber to. Don't Doesn't say it doesn't work. I mean, I think
Right.
PRI is kind of out there. I think it can be helpful in conjunction with some tissue work.
Mm-hmm.
But I also think that there's a lot of things that quality PTs like your team does
Mm-hmm.
do that's why I try to find, one of the biggest things as a sports medicine physician is that, in a non-surgical one, is that you need to find good team. And if
Yeah.
team,
Yeah.
going back to what I said originally, teamwork is where it's at. So,
Yeah. Yeah. That's exactly what I was going to ask you about that. Obviously, right now we do share a patient between our clinic and yours,
mhm.
who is doing absolutely awesome, by the way.
Yeah.
Uh, so can you dive in a little bit more to anybody that might watch this and listen? How does something like your work with the regen medicine type stuff, the PRP,
Mhm.
reducing inflammation symptoms, how does that uh, collaborate or coincide or overlap with like a physical therapy clinic
Mhm.
or physical
Mhm.
therapist or an office?
Yeah, I mean, especially with, like, if we're going to stay on the lower back pain, the lower
Yeah.
back issues, whether it's a disc issue, there's definitely got to be some core work and some, you know, some hands-on, hitting the hip flexors a lot of times are super on
Mm-hmm.
fleek. You can do some soft tissue there. Release the hip flexors. Make sure the person's doing a proper, like, everybody says they do a good plank. I look at like 90% of planks and I'm like, that plank is garbage. You're ragging your back out. You're
Yeah.
breaking that core. So with the background that I have, and I'm a level 2 CrossFit coach. I
Mm-hmm.
coach only myself and other people that I see around the gym. But I got that certification through CrossFit Health, and it's pretty cool to have that.
Mm-hmm.
It's CrossFit Medical Society now, but
Mm-hmm.
so understanding the body better than I would say
Yeah.
probably 99.9% of people on Earth helps, really making sure that they're getting in good positions. Sitting to the toilet is a squat, right? So at the end
Mm-hmm.
of the day, if you're not hip hinging first, I think hip hinge first and core to extremity is how we should be working these things.
That's
And
how
so,
we do it. Yep. Yep. Yep.
so working with a quality group of physical therapists, it all works together, right?
Yeah. Yeah.
This happened, the inflammation was triggered by some sort of movement dysfunction.
Yeah.
And if we don't identify that movement dysfunction, the definition of insanity is doing the same thing over and over again, expecting a different result.
Correct.
You need to change that pattern
Mm-hmm.
that has happened over years, and it's going to take time.
Mm-hmm.
But if we can be the impetus for change with the
Mm-hmm.
injections,
Yes.
platelet-rich plasma, bone marrow concentrate, where your stem cells come from, for your back, for your knees, for your shoulder. There's a lot of stuff that can go on shoulders, and we can get into that
Yes.
another time. I think we probably have a whole other conversation.
Yeah. Exactly.
Um, but if we're not changing that movement pattern,
Mm-hmm.
it's likely going to return. And so
Yeah.
that's where it works in together as a team.
Yeah. Awesome.
Yeah.
Let's uh let's talk about stem cells because I know a lot of patients, and I'm sure you
Yeah.
get this a lot of our patients, we get the PRP questions
Yep.
and the gel they talk about, but they
Mhm.
mention stem cells.
Yep.
And tell everybody, is it legal here? Is it illegal in the States?
Yeah.
Do you guys do something similar? What does that look like?
Yeah.
And can you give us some insight onto that?
So my hard and fast on stem cells is, if
Hmm.
somebody's telling you they do stem cells and they
Hmm.
don't call it bone marrow concentrate here in the United States, is they're doing it wrong.
Okay.
Okay. There's a lot of charlatans who
Hmm.
are giving people stem cell procedures that only consist of growth factors and cytokines, period.
Hmm.
There are zero stem cells in any of the frozen umbilical, placental, or amniotic tissue products. And
Mm-hmm.
there was a statement that I signed along with all my non-surgical people and surgical orthopedic doctors. Don Buford's a good friend and colleague of mine out of Dallas, Dallas. I think it's Texas Orthopedics, Orthobiologics, but
Mm-hmm.
he described the Buford complex in the shoulder. And
Mm-hmm.
so Don Buford, he's a shoulder and elbow surgeon, but he uses more bone marrow concentrate, which is
Mm-hmm.
where your stem cells come from,
Mm-hmm.
right? And it's a portion of stem cells with growth factors plus cytokines.
Okay.
So the people who are telling you and putting stem cell out there, if they haven't been around for 5 years, there's a reason they haven't been around for 5 years.
Yeah.
It's because by the time 5 years comes, the FDA has gone to them and said, hey, listen, show me that these products, because the FDA, the Fed, I like to call it the Fed because nobody likes the
Mm-hmm.
FDA anymore.
Yeah.
Um, the, the
Yeah.
federal government looks at anything that like is being marketed, and
Mm-hmm.
that's the FTC, right? So the Federal
Yep.
Trade Committee looks at
Yeah.
it and goes, is this safe?
Mm-hmm.
Are these people doing things that are safe? Well, what ends up happening is these groups that are the charlatans, there's been infections from these products that are not through three-phase clinical trials, and they're
Mm-hmm.
not safe for patients.
Mm-hmm.
Liveon is a group that you can look up, Liveyon. They had infections that because they were injecting them to people's eyes, and what ended up happening, people got eye infections and lost their sight
Wow.
from these stem cell injections.
Mm.
And so in orthopedics, I utilize bone marrow concentrate from a patient in the
Okay.
same surgical procedure with minimal manipulation, and I use it for homologous use.
Mm-hmm.
So those are within the scope of practice of medicine. Okay. And so those are legal along that pathway.
Mm-hmm.
And so what how the Fed views stem cells is that nobody has been able to produce any umbilical, amniotic, or placental product
Mm-hmm.
that's gone through three-phase clinical trials to make sure that they are, number one, producing live stem cells and have cellular studies that show that they can actually produce these stem cells, right?
Mm-hmm. Mm-hmm.
So what pains me is that I have a patient of mine that she said she got a stem cell procedure, and then she came back and said, I paid $12,000 for this, and
Mm.
I've gotten no help whatsoever. And she put it on her
Man.
care credit card, and she's still paying it off because she thought this was going to be the end all be all for her. And
Mm-hmm.
I did PRP on her and got her better.
Mm.
And so like that's really the biggest issue I have with it. Now, I'm going to tell you
Yeah.
right now, the state of Florida is about to contradict the federal government. And as of July 1st, there was a bill that was pushed through Congress.
Mm-hmm.
Unfortunately, even with I'm on the FOMA board, I was working with all the attorneys and trying to make sure that things were done appropriately because,
Mm-hmm.
again, we don't recognize those products that are being created as stem cell products. They're
Mm-hmm.
again now the guidelines that are being set forth are a GMP, and this is getting like super in the weeds of this.
Mm-hmm.
And the GMP standards are being instituted, and they're supposed to be instituted for all these umbilical, placental, amniotic products.
Mm.
I will tell you that the enforcement of those standards is almost nearly impossible
Mm.
for the state of Florida unless the Fed steps in and is going to
Mm-hmm.
supply these. And so my fear is that this bill is going to pass, and there's going to be a lot of people in the state of Florida who are going to jump back on this ship of profiteering off of
Yeah.
patients in pain. And
Yeah. Yeah.
that is hard and fast. I'm going to probably release a blog either the end of this week or beginning of
Mm-hmm.
next because it's very timely
Mm-hmm.
and to talk about the people who have experience in this field would tell you that everything that I said was factual and accurate. The people who want to profiteer off of patients' pain
Mm-hmm.
would say, "Oh, Dr. Torrance doesn't know what he's talking about."
Yeah. Yeah.
I didn't get on these boards and I didn't get on these things for any reason. I do things that help my patients and I practice evidence-based medicine.
Yeah.
And so that's my fear. And I'm going to do everything I can to put out and have conversations like this with yourself
Yeah.
so that you
Absolutely.
can educate patients. Patients education is the biggest thing. I would
Yep.
tell you that there's only about 10% of people that even know that orthobiologics exists.
Right. Yeah.
And there's so many applications in orthopedics by itself that it's too much to talk about we could probably talk here for 24 hours, and I could talk to you
Yeah. Right.
each individual pathway
Right.
and how we could help with each thing, right?
Uh,
And so that's the problem, and that's why part of my I have hour-long eval. Part of that is about 15 minutes of education
hmm
and making sure that the patient is educated on exactly what's going to help them the best. And a lot of people come in and they want stem cell. And listen, I'm doing 3 bone marrow aspirations tomorrow, right? I do my fair share of stem cell procedures. However, if I don't think you need it, I would
hmm
recommend that we do platelet-rich plasma. Um,
Yeah.
I'm not sitting here. I'm doing what's best for my patient. I'm not
Right.
doing what's best, for Dr. Torrance and the practice
hmm
pocketbook. I do what's best for my patients at the end of the day, and that's my obligation to my patients. And our mission is to get you back to doing what you love. So,
Yeah. Love that. It's awesome. That's a lot of good information there for sure. There's some,
yeah.
yeah,
But
definitely
no,
some, yeah.
and so that being said, in certain indications, there, bone marrow concentrate and stem cells are
hmm
the right way to go. I mean, I would tell you that based on one of the studies that just came back from Dr. Centeno et al. Dr. Centeno founded Regenexx.
hmm
It shows that partial thickness and full thickness tears that are non-retracted
Yeah.
um, do fantastic. 73% of the MRIs on 2-year follow-up show that the
hmm
MRI had signs of healing in the rotator cuff, and
hmm
subjectively, the person was better, right? So
Yeah.
that's a really good study that we can have to stand on for bone marrow concentrate and stem cells for rotator cuff. Knee arthritis is another big one. If it's severe knee arthritis and
Yeah.
somebody's got some bone marrow lesions, what we look for. There was
Okay.
a study by Dr. Felipe Hernigau out of Paris. And
hmm
what we do that's a little bit different than other people is that we'll not only inject the joint, but we also inject the bone itself, which is a
Mm.
painful procedure. But at the end of the day, what we're doing is we're injecting into the bone to help the bone kind of reset its healing processes.
Yep.
His study showed that 80% of patients avoided a knee replacement 15 years later. So, so knee arthritis, backs, and shoulders, I think some of my favorite procedures to do, and they do really, really, really well.
Awesome. Okay. Perfect. Because I was going to ask those questions. What types of patients? Um, well, that's awesome. I don't want to take too much more of your time.
Yeah.
So, Dr. Torrance, I'd love to ask if whoever is watching gotten to this point, how can they find you?
Okay.
What's the best way for them to contact you to make an appointment to
Mhm.
to schedule with you?
Yeah. So if you go to newregenortho.com,
hmm
regen, REGEN ortho.com. That's an easy way to find our website and fill out a candidate form, and our team will reach out to you to get you in for an evaluation.
hmm
We're not a group we're going to do again, hour-long evaluation and make a recommendation. Don't expect to come in. Some patients come in and like, hey, we want to do the procedure the day of. That's not how we work. We want to make sure that you understand and are educated appropriately on what we're doing before we do it. And so
hmm
that's one of the best ways to find us.
Cool.
941-357-1773 is our phone call if you want to give us a phone call, and
Cool.
click I think press 1. It's a new patient prompt, and you'll talk to somebody. We have an education center that will get on the horn with you and talk to you about what your condition is, what you can expect. We take most insurances for evals, whether it's Medicare, Blue Cross, Cigna, Aetna, and I think that we take TRICARE for
Mhm.
evaluations. And if not, we have a very good self-pay rate if we don't. And then
Mhm.
our team will talk to you about, after the evaluation, we'll talk to you about a recommendation based on your condition, and we go
Mhm.
from there. So,
Cool.
you know,
Dr. Torrance, lastly, any final encouragement for someone who's trying to avoid surgery but doesn't know what their options are?
yeah. So obviously, find a good physical therapist. If you're watching this, obviously you know Dr. Clark and his team, and you're working with a great group of physical therapists
Yeah.
who are going to help you avoid it if you can. If
Mhm.
that's not moving the needle, as I like to say,
Yep.
and you want to avoid surgery, we're a great option. Come see us, and we're going to tell you whether you're a candidate or not. If you're not a candidate, we'll let you know, and we can hopefully help steer you in the right direction. So,
Cool.
good, honest, trusting your clinician is the biggest thing here, and I appreciate the trust from Dr. Clark to get on here today, and
Yeah. Likewise.
look forward to continue working with you in the future.
Likewise.
And yeah, so Dr. Clark, tell me what your favorite patient is before we get off.
My favorite patient.
And what's the favorite patient? What's the home run for? What's a home run? What comes in and 9 times out of 10, Dr. Clark, you're sending them home with singing your praises. I mean, 90% success rate is pretty good.
Yeah, that is. Well, I think it comes with the diagnosis and the type of patient too.
Okay.
Um, for me, first and foremost, I love post-op.
Okay.
I've always loved post-op. I don't know if
Okay.
whatever. I love ACL repair and even total knee replacements. I just enjoy the process and just kind of guiding the person along natural history and the course and helping them return to, for sport or whatever it is and beyond where they were even before. But if it's not post-op, anything that's lower extremity related is probably my favorite. Okay. So I'd probably say somebody that is an active adult, somebody that wants to be there in the clinic. You get people that sometimes they're not sure, they don't want to be there. They're there for different reasons. But the person that is dedicated to taking ownership of their body and their health is first and foremost. It makes obviously things a little bit easier.
Yeah.
And, if, like I said, the active adult athlete, runners, gym goers, things of that sort are kind of my bread and butter, I would say.
Active.